Hello and welcome to our patient education video designed to familiarize you with the continuous passive motion machine, or CPM machine for the elbow. Let's look at the device. Here we have your standard device. This right here is your CPM machine. This is an IV pole designed to maneuver the machine into different positions so you can rest your arm in a seated position. All right. What we have back here is the knob. Please support the device, unlock the black knob, and you can move the machine up and down, as well as turn it in and out to adjust it to be more comfortable in a seated position. As well, once locked into place, you can also adjust the pitch, which is this black knob right here, and as you see, it moves up and down to make it more comfortable and easy to use. Let's just quickly go over positioning of the arm without the machine. You want to first place your arm on a 45-degree angle, such as you see here. Right? You also want to lift your arm to about 90 degrees or just slightly above 90 degrees in a comfortable position to help facilitate the drainage of the swelling. What you also want to do is you want to get yourself as close to the edge of the chair as possible, right? So you can sit there in the most comfortable position to encourage the arm to flex and extend as much as possible within the given range of motion provided by the machine. Now let's place your arm into the machine. When choosing a chair for the machine, you want to choose a chair with an open bottom and no arms. Right? Have the patient slide as close as possible to the edge of the chair, right? And then bring in the machine. Position the machine as well as close as possible to the patient so the patient is comfortable. You want to take the patient's arm, place it into the machine, have the elbow slide as close as possible to the bullseye, or the crease of the elbow should be at the bullseye of the machine. Right? Once you have the patient in that position, or once you are in that position, you should strap the upper portion of the hand in, then the lower portion at the wrist, not too hard, but fairly securely, as well as the arm strap should be tightened. And again, not too tight, but just tight enough. Once strapped in, you can adjust the height of the machine to make it more comfortable for the patient. As previously stated, support the machine and do the black knob and lift it to a height that's comfortable for the patient. Is that okay?
Yes.
Once the height has been adjusted, you can also play with the pitch to make it more comfortable for the patient. As you see here, currently we have it on the pitch that we want it to be at, slightly above 90 degrees and leaning backwards to facilitate the drainage of swelling. But as I'll show you here, how you will adjust the pitch, just so you can see the arm moving up and down, and seeing what might be more comfortable for a patient. This would be slightly uncomfortable for the patient, whereas this would be slightly more comfortable, as the shoulder is sitting back in a better position. If you don't have a chair with an open bottom, you can position the machine in this fashion. Slide the machine over as much as possible, right, so that the edge is against the edge of the chair. You adjust the rotation of the machine, again, with this black knob in the back. And as we said previously, position the patient's arm into the machine. The crease of the elbow is at the bullseye. And as said previously, you adjust the height up and down based on the comfort of the patient. You want to maintain the 45-degree angle and slightly above a height of 90 degrees to facilitate drainage of the swelling. Now that we've positioned your arm, let's get started. Once the unit has been plugged in the back, as well as the handset, we can put your arm through ranges of motion specified by your surgeon. All you have to do to get started is press the yellow button. And as you see here, the arm will go through the ranges of motion that you have set in previous steps. Always ensure that you're comfortable. As the arm comes forward and into extension, sometimes the elbow will slip back. So as it's flexing back, you might have to slide your elbow a little bit closer to the edge so that your crease of the elbow is in line with that bullseye we talked about earlier. Let's now go over the process of milking or cycling. What this allows is for the drainage of swelling. We have set the machine at a range that is greater than your expected range post-surgically to ensure that you can facilitate the drainage of swelling. Please refer to the patient handout on milking and cycling, as well as the programming of the unit for this procedure. What I'll do is I'll hand the remote over to the patient, and we'll start the milking process. Right? What you do is you press the yellow button to start the procedure. We'll have you come back as far as possible, or to the point where you feel pain in your elbow. Now you're going to reverse the procedure by pressing the yellow button. It automatically does it for you. Take it back 20 to 30 degrees. Once you hit that 20 to 30 degrees, please press the yellow button again and reverse the procedure. You're going to repeat this for approximately 10 minutes. Again, take it to the point where you feel discomfort or pain, and then reverse it 20 to 30 degrees. Once you've completed 10 minutes of flexion, we'll now go into extension. Okay. With extension, you'll take it again as far as possible to the point where you feel discomfort or pain. Once you feel that discomfort or pain, you'll reverse the procedure again 20 to 30 degrees by pressing the yellow button. As you see here, she'll now reverse the procedure 20 to 30 degrees. Good. And she'll stop it and again reverse the procedure by pressing the yellow button. This patient education video provides you with basic information on the use of a CPM machine. The UHN and UHN Rehabilitation Solutions staff will work closely with you during your rehabilitation process. During the use of this machine, you should experience some discomfort and pain. Should your pain persist or worsen, please contact your healthcare provider to see if use of the machine should continue. Should you have any questions at all, do not hesitate to contact your healthcare provider. Thank you for watching the video.